Okay, he's in respiratory distress. All right. How is epinephrine beneficial to a patient with a serious allergic reaction? Okay, what would you need to know about epinephrine before administering it? Okay. You think you need to know the indications, the contraindications, the side effects, the dose, how you can give it, the mechanism of action. Alright. You will be responsible for administering or assisting the patient with administration of certain medicines. Unlike a mathematician, you can't erase your mistakes and start over. Once you give a medicine, that is it. Alright? You can't pull it back out. Alright, what exactly is a drug? A drug or a medication is generally defined as a substance that is used as a remedy for illness. Alright, a drug is a chemical substance that is used to treat or prevent diseases or conditions. The terms drugs and medications are often used interchangeably. The study of drugs is referred to as pharmacology. When the correct dose is appropriately administered, the patient's condition may improve significantly and uncomfortable symptoms may be relieved. If administering inappropriately, some drugs can cause serious side effects and deterioration of the patient's condition. If the orders allow EMT medication administration, the EMT will obtain the aspirin and instruct the patient to chew the aspirin. Then the EMT will place the aspirin in the patient's mouth. If the orders allow only patient-assisted medication, the administration of aspirin, the EMT will obtain the aspirin, instruct the patient to chew the aspirin, then the patient will hand the patient the aspirin tablets and have the patient place them into their mouth. Medications that the EMT administers are either carried on the EMS unit or are prescribed to the patient. The prescription medicine may be found on the patient or at the scene. It has become more common for EMTs to carry most or all the medication they are able to administer on the EMS unit. It's extremely important to become familiar with your local protocols, as this dictates not only the medication that can be administered, the specific doses and routes, but also which medications the EMT can administer and which are to be patient-assisted. Alright, oxygen. This is one of your medications. Alright, oxygen is an odorless, tasteless, colorless gas that is found in the ambient atmosphere at a concentration of approximately 21%. When it's used for medical purposes, its administration as 100% compressed gas concentrate. By increasing the oxygen concentration breathed in by the patient, you attempt to put a higher concentration of oxygen into the alveoli of the lungs. By doing so, you increase the amount of oxygen crossing over from the alveoli and into the pulmonary capillaries. In healthy individuals, high concentrations of oxygen have been found to reduce cardiac output and left ventricular perfusion, which reduces systemic and coronary artery blood flow. In patients with heart disease, hyperoxia, which is a high concentration levels of oxygen, leads to coronary artery vasoconstriction and higher coronary artery resistance, thereby reducing coronary artery blood flow to the heart muscle. This can lead to a reduction in cardiac output, cardiac ischemia, and possible life-threatening cardiac rhythm disturbances. In some conditions, such as ischemic stroke, in which a cerebral artery is blocked in the brain, or an acute coronary syndrome involving coronary artery blockage in the heart, administration of oxygen, when not indicated, may actually worsen the tissue damage, causing reperfusion injury. Alright, this reperfusion injury occurs because of an increase in the free radical production when the artery is reopened and blood supply reestablished to that once ischemic tissue. In the patient with a medical condition, if the breathing is adequate and the SpO2 is 94% or greater and no other signs of respiratory distress, hypoxia, hypoxemia, or poor perfusion are present, there is no need to administer supplemental oxygen. If the O2 is less than 94% or signs of respiratory distress, hypoxia, hypoxemia, or poor perfusion are present, initiate oxygen therapy via nasal cannula at 2 liters per minute and titrate to maintain an SpO2 reading of 94% or greater. If there is severe hypoxia present, a non-rebreather mask at 15 liters per minute could be used. All right, your non-rebreather mask goes anywhere from 10 to 15 liters per minute. In a patient with a traumatic injury, especially one involving the brain, thoracic organs, or spinal cord, or one in which there is evidence of respiratory distress, hypoxia, hypoxemia, or poor perfusion, or when the potential exists for significant bleeding or shock, the American College of Surgeons recommends the delivery of high concentration of oxygen to achieve and maintain an SpO2 of 95% or greater. This is typically achieved through the use of a non-rebreather mask set at 15 liters. If bag ventilation is being performed on either a medical or a trauma patient, regardless of the condition or injury, a high concentration of supplemental oxygen must be delivered. Oral glucose is absorbed through the mouth and through the intestines and eventually into the blood, where it raises blood glucose levels, making more glucose available to the starving brain cells. The brain cells will once again begin to function normally. This is seen as an improvement in the mental status. Once absorbed, activated charcoal. Once absorbed, the poison is carried by the charcoal through the digestive tract and then eliminated in a bowel movement. The efficacy of activated charcoal has been questioned, and it may have harmful effects if aspirated. Activated charcoal has been removed from many protocols. We do still carry it in Louisiana. Aspirin. The administration of aspirin may keep the coronary arteries that deliver blood to the heart from completely closing. EMTs do not administer it for its analgesic or pain relief effect. All right? Inhaled bronchodilators. This is going to be your albuterol. It's going to be the one you see the most. Are medications that cause the bronchioles to dilate. They contain beta-2 agonists that are topically deposited through the inhalation route on receptor sites in the bronchial tissue. When the beta-2 receptor sites are stimulated, it causes the smooth muscle to relax, leading to dilation of the bronchioles. This causes a decrease in airway resistance with a resultant increase in airflow and an improvement of oxygen delivery to the distal alveoli. Most often, you will find metered-dose inhalers prescribed to patients with a history of asthma, emphysema, chronic bronchitis, COPD. All right, these patients have episodes of bronchial constriction in which the bronchioles in the respiratory tract constrict, increasing resistance to airflow to the lungs down to the alveoli. The patient experiences shortness of breath and signs and symptoms of respiratory difficulty from the increased effort to breathe and from the decreased flow of oxygen to the alveoli. Inhaled bronchodilators, blah, blah, blah. You can only administer medications with the MDIs, okay? You cannot give this through a small volume nebulizer, all right? But they can be given both ways. Nitroglycerin is used to treat patients with disease of heart that involve partial blockages or spasms of coronary arteries. The medication comes as a tablet or spray that is administered under the tongue. Nitroglycerin dilates blood vessels in the body, causing a reduction in systemic vascular resistance. This reduces the weight load of the heart by decreasing the force of contraction necessary to eject the blood against a lower blood pressure in the aorta. The reduced myocardial weight load results in a decrease in the in the heart muscles' demand for oxygen. At the same time, nitroglycerin's vasodilation of coronary arteries increases the supply of oxygenated blood to the heart muscle. Because the major side effect is hypotension, it's important to measure the blood pressure both before and after administration. Epinephrine constricts the vessels, alpha 1 and alpha 2, increasing the blood pressure, dilates the bronchioles, which is beta 2, allowing the patient to move more air into the alveoli and decrease capillary permeability, which is alpha 1 and alpha 2, which reduces the leakage of fluid. You're going to see this with your anaphylactic patients. Narcan or naloxone. Depending on the dose and route of Narcan, the opioid that the patient overdosed on, the opioid may stay in the body longer than the Narcan does. Therefore, it may be necessary to repeat the dose of Narcan to continue to reverse the effects of an opioid drug that was taken. Some opioids, such as fentanyl, are potent and may require several repeat doses of Narcan to reduce the respiratory, depression, hypotension, and sedative effect. Narcan itself has no effect on a patient unless an opioid drug is currently in the person's system. Therefore, it's relatively safe to administer in either suspected or known heroin or other opiate drug overdoses. But however, keep this in mind. If they do not have the signs and symptoms of a narcotic overdose, why are you going to introduce something into their body? Number one, that's not natural. All right. Number two, Narcan is very hard to come by these days. Okay. Everybody that's anybody is getting Narcan. Honey, we get it out of East Carroll like it's candy. They don't even have pinpoint pupils, depressed respiratory status, unresponsive. They're sitting up talking and we handing it out like candy. I don't know why. I have yet to figure that out. But however, Narcan is very hard to get these days. So please keep that in mind. All right, kneeling next to the patient, Nate can hear stridor and wheezing, and he detects a weak, rapid pulse. The patient is unable to speak with a history of bee sting, allergy, a witnessed bee sting, and signs of severe distress associated with anaphylaxis. Nate knows he must act quickly. Bless Nate's heart. Following protocol, Nate prepares to administer the epi-auto injector. All right, what is the medication form that Nate is about to administer? Is it a pill? Is it a paste? It's an injection, okay? What route is Nate going to administer this medicine?
It'd be the thigh, wouldn't it?
That's not the route. Huh? Intramuscular. I am. What are the steps that Nate must follow in administering this medicine? All right. Does anybody know the 5 rights of medication administration?
Right patient, right dose, right route, right time. I think I'm right date. Transpire, right medication. What?
Easiest way to remember it. P M D R D T. All right. Patient, med, dose, route, documentation. Those are the 6 rights of medication administration. PMD, RTD. Easy peasy.
But it does need to be not expired.
Why? We give an expired epi because we can't get it. You think just because it's like milk, it will go past its expired date. Would you rather, if it were you, would you rather somebody give you something that's a month expired and let you live, or give you something that's expired, or not give you something that's expired and you die?
As long as you didn't leave it out in the heat for days on
What if they do
end.
die?
What if they die because you didn't do anything?
They died, you gave expired shit.
They're not going to die because you gave them expired shit.
Expired chicken, I feel like you might die.
Oh my God. All right, drugs have the following categories of names. You have a chemical name, a generic name, a trade name, and an official name. The chemical name describes the drug's chemical structure. It's usually the first name associated with the drug. Generic also refers to the non-proprietary name. The generic name still reflects the chemical characteristics of the drug, but in a shorter form. Trade name, also referred to as the brand name, is assigned to the drug is released for commercial distribution. This is short, easy to recall. All right, this is what most people know their medications by. Then you have an official name. Drugs meeting the requirement of the U.S. Pharmacopoeia and National Formulary are given an official name. Commonly, the generic name followed by the initials USP or NF. Alright, these are examples of nitroglycerin. The chemical name is 1,2,3 for something titronate. Generic name, nitroglycerin tablets. Official name, nitroglycerin tablets, USP. Trade name, Nitrostat. Alright. Here's your common generic and trade name medicines. Oral glucose, you have glucose and instaglucose. Activated charcoal, Superchar, Instachar, active dose liquid char. Nitro, Nitrostat, or nitrolingual spray. Epinephrine, Epiautopen. Albuterol, Provenal, Ventolin, ProAir, Acuneb. Xopenex, that is not something you will give. You need to know what it is though. Ipratropium bromide and albuterol, so Duoneb. Aspirin, you have Bayer aspirin, Buffex, Bufferin, whatever. Naloxone, Narcan nasal spray. Right, route. The route of medication is the way in which a medication enters the patient's body. The route by which a medication is given affects how quickly the medication is absorbed into the body to reach the site of action. Routes used by EMTs include sublingual, oral, inhaled, and intramuscular injections. Alright, so you have sublingual, what does that mean? Under the tongue. Oral, what does that mean? Okay, with aspirin, it's chewed and swallowed. Okay, inhalation, breathing it in. Intramuscular, okay, it's injected into the muscle. Intranasal, nasal spray, and subcutaneous. We used to give episubcutaneous. What is subcutaneous? Under the skin, okay. Alright, sublingual. Placed under the tongue, the patient doesn't swallow the medicine. It is dissolved and absorbed across the mucous membranes in the mouth. Usually has a relatively quick absorption rate into the blood. Oral, the drug is taken by mouth swallowed, also known as per os or PO. Except for activated charcoal, the medicine is typically absorbed in the small intestines. Also known as the enteral route because it uses the digestive system to absorb the medicine. Inhalation, the medicine is prepared as a gas or aerosol and is inhaled by the patient. This method typically deposits the medicine directly to the target sites where the effect is needed. Patient must be spontaneously breathing for this route to be effective. IM, the drug is injected into a muscle mass. The absorption is relatively rapid. Requires the use of a needle, therefore it poses the danger of needle stick or injury to you. Intranasal, the medication is sprayed into one or both nostrils using a specialized delivery device called a mucosal anatomizer device, a MAD device that is either attached to a syringe or also built into the device. Actually, I got some of these the other day. This is the Narcan. Nasal Narcan. This is what it looks like. You give a squirt up one nostril, a squirt up the other nostril. It's a total of 4 milligrams. Okay. Subcutaneous. The medication administered by a subcutaneous route is injected under the skin into the subcutaneous layer. Are designed to produce a slower absorption rate than IM injections. Alright. Alright, medication forms. You have a compressed powder or tablet. Alright, this is your pills. Alright. Nitroglycerin tablets and aspirin are examples of this medication form. You have liquids for injections. Thank you. Alright. If you can see the liquid, we want to look at the liquid, make sure it's not discolored, doesn't have any particles floating around in it. This is what an epiautopen looks like. Epinephrine is injected into the muscle in its liquid form. Narcan is a liquid that can be administered intranasally or with that device that I just showed you. You also have gel forms. It's a thick, viscous substance that goes into the mouth. All right, this is what your oral glucose looks like. You have suspensions. This is going to be your activated charcoal. Okay, drug particles that are mixed in a suitable liquid. These mixtures don't remain mixed for long periods of time and have a tendency to separate. They must be shaken well before administration. Fine powders for inhalation. This is a form of a crystalline solid that's mixed with liquid to form a suspension. You must shake these as well. Okay, usually delivered by a metered dose inhaler. This is going to be your albuterol, your Ventolin. All right, these are spacers. We use these with kids. Okay, you squirt it in there. They take a big deep breath. They can't coordinate you squirting and inhaling at the same time. Okay. Small volume nebulizers. You will probably use these on an ambulance. However, if you are working a basic truck, you will not be able to do this without a medic there. It uses compressed gas from an aerosol in a mixing chamber. And what we do, this is what it looks like. You have a mask, and then you have like the little pipe looking thing. Huh? Yeah. So, this right here comes apart. This is the chamber that the medicine goes in. Same thing right here. You just unscrew it, pour your medicine in here or in here. You need to turn this up to at least 8 liters of oxygen per minute, okay? I say 8 or till it smokes, all right? And you put it around your patient's face, or you give them the little pipe and let them smoke on it. Oxygen is gas form, all right? Oxygen is considered to be a medicine. All right, sprays. Spray droplets can be deposited under the tongue. Nitroglycerin, often in tablet form, can also be in a spray form. I think I sent that around the other day. This is your nitroglycerin spray. No. Because as soon as you tell them don't swallow, that's what they're going to do, swallow. It's human nature, I think.
Tells them not to do it.
All right, so for each medication, you must understand the following information: the indications, contraindications, dose, how it's administered, the actions, and the side effects. For tomorrow's class, since we will not be here, Monday morning, your drug cards are going to be due. All right, I'm going to show you how that works. All right, indication. What is an indication? The most common use of drug in treating a specific condition, geared towards relief of signs, symptoms, or specific conditions. Contraindications, situations in which the drug should not be administered because of the harm it could cause. Dose, the amount of drug that is given to the patient. The route by which the medication is given to the patient. This is your route or your administration. Okay, I call it route. Actions. The effect of the drug has on the body. There's a therapeutic effect, which is the intended positive response, and then you have the mechanism of action, is how the drug works to create its effect on the body. All right, side effect. Actions that are not desired and that occur in addition to the desired therapeutic effects. All right, so how to administer medicine. Obtain an order from medical direction. Select the proper medicine. Verify the patient's prescription. Check the expiration date. There you go, Sayward. Check for discoloration or impurities. Verify the form, route, and dose. Check the 5 rights of medication administration. We know 6 rights. What are the 6 rights? You can read. Yay. Document medication administration. Okay.